Good evening and welcome to blackdoctor.org. I am your host tonight, Shamika Rhymes. And before we dive in, let me know where you are watching from in the comments. So we are back for part two, and this is National Nutrition Month. So we're kicking off part two of our special series where we're dedicated to empowering the Black community through food, health, and wellness. And so tonight we're going to take a look at intermittent fasting. And it's one of the most talked about approaches to eating. But is it just a trend? Or is there some real science behind it? We're going to talk about it tonight. We'll explore the different fasting methods, how they compare to popular diet trends, and whether they truly work or not. So back to join me on this panel, and I'm super excited to see them. We've got Dr. James Thompson, Medical Director of Healthy Living with a Vision Foundation. Welcome back, Dr. Thompson.
Thank you. It's good to be back.
And we've got Dr. Erica Francois. She's a doctor of nursing, practice in advanced practice, registered nurse, and the owner of New Vitality Health and Wellness. Welcome.
Hello.
So I'm excited about this conversation because I don't know about y'all, but like you just hear all the things that, you should do this for your nutrition, you should do this. So I think tonight we're going to set some people straight. So I think we're going to kick this off by talking about, and I'll start with you, Dr. Thompson. What is intermittent fasting? How does it work?
There are different forms of fasting. Intermittent fasting is one of them. And you can take it for literally what it says. It's intermittent periods of not eating. Mm-hmm. And we all naturally fast. When we go to sleep, we're not eating. Most of us. So generally that's why we get the name breakfast from breaking fast. Mm-hmm. And so intermittent fasting has really morphed into a concept of more like a time restricted eating. And so there are different subcategories of it. You can fast for 12 hours and then have a 12-hour window where you are eating. Or you can fast for 16 hours and have a more restricted hour, rest of the day for eating, like 8 hours of eating. And then some people are even more restrictive. It depends on the individual and what their goals are. But it's a type of it's a time where you give your body a rest from having to be in a state of digestion. And so we are usually in an anabolic state where we're taking on nutrients and digesting them. And then there's a catabolic state where we're burning those nutrients and we're not forcing our bowels to digest them. And so intermittent fasting takes advantage of that. And during the time you're fasting, the bowel gets to rest. The bowel keeps working, but there's a period of time where it isn't overworked. And during that time, too, there are certain other physiologic things that occur. There's something called autophagy, depending on how long that fasting period is, and that's a cellular cleansing mechanism. Auto means cell, the phagy part means to eat. And so it's a self-eating, a cellular cleansing mechanism that can also be stimulated by exercise, but also by fasting. Also, of course, when you're fasting, you're not taking in more calories. Mm-hmm. And so that can perhaps have some bearing there, as well as conditioning your body for periods of not eating. My own experience with it when I did intermittent fasting for 2 days a week, was that when I wasn't fasting on the other days, I didn't feel like I had to have food so often. I didn't feel like I have as many snacks. And sometimes a third day of intermittent fasting would just occur because I just wasn't that hungry. So that's an experience of others. Some people have been able to lose weight that way. But I warn people, if you're eating the standard American diet and you decide to do intermittent fasting, you may be very disappointed in the results. Because I think when you pair intermittent fasting with healthy eating, healthy food choices, more plant-based, then you're going to see some of the results that you'd be looking for.
So that explains why it didn't work for me. I tried for about 2 weeks. Explains it. So Dr. Francois, what are the different types of intermittent fasting? Like Dr. Thompson was mentioning the fasting for 8 hours, 16 hours, the different ones. And then there's I've heard of people doing one meal a day, but are there some other ones that are popular? And is one of them more effective than the other?
Yeah, there are some others. One called alternate day fasting, where you every other day you're fasting. So you eat normally, as you would on one day, and then the next day you eat 500 calories or less, on that day, and then you eat normally the following day. And then there's also, like Dr. Thompson had mentioned, the time restricted fasting, where you're fasting for 16 hours, and then you're eating for 8 hours. Um, and so those are some of the several different types of the intermittent fasting of diets, and the main focus, they when you're talking about like intermittent fasting, is more so on it's focused more on like um the time that you eat, rather than so much of like what you eat, even though we're really supposed to keep that in mind. But the main focus is on like the time that you eat. And there have been several studies about intermittent fasting, and how they compare to like restricting, like counting your calories. And it's been pretty close as to how much weight loss occurs with each one. There was the one study that they did with, like, it was very small, like only 100 individuals with obesity, that took that some did the intermittent fasting, some did the calorie restriction, and they both compared. Like, I think the intermittent fasting, they lost 6.8% of their initial body weight, and then those that were in like just a caloric restriction lost 6%, of their, initial body weight. So pretty close, when you take a good look at it, when you're talking about fasting versus, counting your calories.
Okay. I forgot to remind everybody, if they have questions, please drop it in the chat. I was just thinking, I saw some comments popping up. So I want to remind you all, please, if you have questions, feel free to ask. Um, so what are some of the most popular diet trends today? Because I've seen, keto, I've seen just different ones, and especially with the intermittent fasting. But what makes them stand out? And I already know which one is probably Miss Dr. Thompson's favorite. We talked about that in the first part, but Dr.
Right.
Thompson, what are some of the most popular diet trends?
Well, I would say probably the Mediterranean diet is very popular right now, and people have had some good results from it. If you look at scientific studies, there have been some decrease um, that decreases your risk for stroke. If initially it was thought it would also decrease your risk for heart disease, but studies I've reviewed lately just don't significantly support that.
Mhm.
Um, Now, certainly when you compare it to standard American diet, a lot of risk factors do go down. But I'm speaking comparing it to a whole food plant based lifestyle, and so that's a popular one. As you mentioned, paleo and keto tend to be real popular because people love to be able to continue their bad habits. So if they can have evidence or that can be healthy, there's just like the Atkins diet that was
Mhm.
so popular. I had friends eating those bacon and bacon rinds and just loving it, right? And initially they lost weight too, so they were like, "Oh yeah," but the problem with that is you get a short-term gain for long-term pain. And I don't mean pain literally. I mean pain from the standpoint that you're at higher risk for heart attack and strokes and really all-cause death. People don't realize that if you do it for a long period of time. Now it's kind of self-fulfilling with keto, which I found because I was getting real frustrated with some of my patients coming in saying they wanted to do keto. It kind of self-corrects because most people can't sustain it. It's just not sustainable.
Right.
so,
Yeah.
so they're all happy at first when they lose some weight, and then 6 months later, they're like back where they started. But it's really not a good diet because if you think about it, it's just counterintuitive. Eating something that has a lot of saturated fat, cholesterol, some trans
Right.
fats, lots of protein. Really, most Americans, whether they're eating you know, standard American diet or paleo, most Americans are eating more protein than they need. And that's always the most common question. If I go plant based, where am I going to get my protein, right?
Yeah.
But most, for women, it's like the average size woman 45 grams, and the average size man 55 grams, and that's not a lot. And the average person in this country eating standard American diet are eating more than twice that. And most vegetarians that eat a balanced diet or whole food plant, they're eating more than enough. You're getting proteins because there's proteins in all plants. It's just a little more. There's more proteins proportionally in protein and whole grains. And so the Mediterranean. The thing about the Mediterranean, some people may be wondering, well, what's the difference? Well, Mediterranean lets you eat some meat, some fish. Depends on, there's some different types. Some say just oily fish like salmon or something, and then you can drink a little wine, things like that. So it's a little more flexible. So people do tend to migrate more towards that. It's not as restrictive as people see it, but on the other hand, you don't get the type of results that many studies have shown if you do kind of avoid the meat and the oil, because that's the other thing. People don't want to give up that oil. Oh, what about olive oil? But olive oil has the same amount of calories. If you're trying to lose weight, trying to have lower risk for cardiac, then you're going to really ratchet down those oils and try not to eat that processed food either. So I'll stop there.
Okay. Did you want to add to it? I feel like you do.
Going back to like the ketogenic diet too, and it's a very old diet. I think back in I think Dr. Thompson 1920s or something.
Exactly. Yes.
Where it was initially created to help those with epilepsy, seizures, and now we're using it, of course, to lose weight. But as he mentioned, it's not sustainable. A lot of patients, they like to do it because we want fast results all the time. We want quick results. We want to lose 20 pounds in 5 days, and you feel like you can do this because, yes, you do see the scale move initially when you are following attempting to follow keto diet. There's another type of ketogenic diet that's really popular right now called the carnivore diet, where it's all meat. And it was something happened just recently. I think it was in January. There was a male patient that showed up at Tampa General Hospital. It made the news nationwide because he developed these yellow deposits in the palm of his hands. He was doing the carnivore diet for about 6 to 8 months. Just meat and eating butter, like pounds of butter, and oil. And he developed, I don't know if I can pronounce it, exalthamus or something like that, where you have these cholesterol deposits. And it was all, his palms were yellow, but the cholesterol was just spilling out. There was nowhere for it to go. So it's just coming out of his pores. His cholesterol level was, I think they said the reading said greater than 1,000. So he survived, but definitely he could no longer do the carnivore diet. So you really, really have to be so careful when you're talking about different diets that you want to try, and consult with your healthcare provider first and foremost, before trying any of these diets too. So I know that it's been kind of carnivore diet. I've been hearing about more and more on a daily basis. Can I do it? Because as Americans, we like to eat like the protein. If there's a diet, if you say we could eat meat, and some butter, let's have at it. All the oil, but could be potentially super, super dangerous too. So, but yeah, everyone, you can look it up. If you Google it, man with the yellow hands, you'll see the picture of it. It made nationwide news.
I see a comment. Joyce Elliott, feel free to type your comment in the chat and I'll see it. I see you wrote quick questions, so feel free. But she did say she's been on keto for 2 years. So how long should you stay on keto? I guess that's a good question.
I would say not more than a day, actually. But and
I agree.
That's about how long I lasted.
Well, and I've run into, I'm not going to say this is a situation for her, but keto diets are very hard, and a lot of people think they're on them, but they're not. I mean, they're not really
Yeah.
ketotic, you know. They're
Right.
just eating a lot of meat, and and so if anyone's on it for a long period of time, they should be having multiple, frequent visits with their doctors, looking for inflammatory markers, looking at their lipid profile. I mean, it can mess around with your liver. The most common reason why people have fatty liver in this country is no longer from alcohol or
Mm-mm.
viral infection. It's
Mm-mm.
from diet, fatty liver from diet. So people that are on a carnivore, paleo, keto, they are asking for trouble. And I'm sad that she's been on it for 2 years. That's 2 years of impacting her liver, 2 years of impacting her blood vessels, which are very sensitive to those kinds of things. 2 years of impacting the kidneys. That's too much protein for the kidneys. There's something called hyperfiltration that occurs when you have too much protein, especially animal protein. There's a difference. Plant proteins are healthier. Animal proteins stimulate some chemicals that make you age faster. Two of the ones that have been most studied are IGF-1 for insulin-like growth factor. That's a very good hormone to have high in your blood when you're growing, when you're a child. Not so good when you're an adult. You don't want those latent cancer cells in your breasts or prostate or kidney or someplace else to start growing. So that IGF-1. Um, the other one is called mTOR, which when mTOR is active, and that stands for mechanistic target of rapamycin, that also impacts growth of cancers. So you don't want those levels to be impacting you, maybe making you age faster, giving you a higher risk for cancer. There's a higher risk for cancer in people that are on keto diets. And I would put that right on the same plane as carnivore. To me, it's really pretty much the same thing. The pandemic, there's a study in the British Medical Journal during early on in the second year of the pandemic that showed that people that ate keto had like a 40% higher risk of having severe COVID, whereas those that consumed that were more plant-based, there was about a 70% less risk of having severe COVID. And for people that were pesca vegetarians, the vegetarians that only eat fish as their meat, they were in between. But the bottom line here is the people that were eating carnivorous or keto or paleo, they were at greatest risk to suffer from more ravaging circumstances, suffer from more ravaging impacts of COVID. And it makes sense because who does COVID pounce on? People with high cholesterol, high blood pressure, people that are more unhealthy, people that have disrupted microbiomes. And you eat that much meat with all that saturated fat and cholesterol, your microbiome is going to be disrupted.
Well, it looks like she did say she's 21, but she does look 31 because of the keto. So I think you probably answered maybe the question where she was going with it. Let's see. So let's keep going here. I'm like, whose turn was it? Dr. Francois, how do these diets mentioned compare in terms of weight loss, overall health benefits, and sustainability? I think we've pretty much decided you can't sustain keto,
Right.
or can you sustain any of them? Besides, we already put carnivore and keto on the plane.
And intermittent fasting, is that sustainable as well? It's very hard to do that. When you're thinking about sustainability, greater than 6 months, 12 months, can you do it for that long? And we don't recommend, these diets for those that are, of course, breastfeeding or something like that, breastfeeding, or during pregnancy. Will you see weight loss? Yes, for a short term, yes. I believe with like the intermittent fasting, we typically see between 6% and 8% of weight loss. But here again, it's like the moment, and this is what I hear about, on a daily basis. The moment you stop, the weight returns. With that, but yeah, we already talked about carnivore and the keto diet. But as far as like Mediterranean and paleo diet, those seem to be more sustainable, because these, like Dr. Thompson mentioned, it's like a general like type diet. It's not too too restrictive as to what you're eating. Our theme here and our logo is here is that at New Vitality is that we don't do diets, we make lifestyle changes. Uh,
Mhm.
so it was Shamika, thank you for inviting me, because when I saw, told me to talk about diets, I'm like, oh gosh, we don't do diets. So this is
Yeah.
a good topic for me to discuss, because every time you think about the diets, you think about something short term, or you're restricting yourself. Um, Sometimes it could even be seem torturous, you
Mhm.
know. And what are we doing this for? Ask yourself that question. And what are we doing this for? Are we doing it for weight loss? Are we doing it for health? And when you can answer that question, I'm going to do this for my health. I mean, that means we're going to X out a lot of these different diets, that these popular diets. We might as well just take them off the list. Um,
Mhm.
if we're looking at, we want to live a more healthy lifestyle, some of these things we won't be able to consume.
Okay. I do want to correct. So Joyce said she was actually 31 looking 21. So and on the keto. So she wanted to correct that.
Uh,
Yeah, I would wonder why she'd be doing it for 2 years if it was the other way around. But I certainly hope she absorbs some of what we mentioned, because still there's a short run of things, there's a long run. So she may be looking 10 years younger now, but it's what's on the inside that counts.
Mhm.
And what's on the inside, many studies have shown, is not good when you're doing keto. So that's it.
Why do you think that this is for both of you? Why do you think that certain diet trends have become so popular? Do you think is it science driven, or is it social media influencers, or do you think it's a mixture of both? I know I have my thoughts on it, but what are your thoughts? You're the experts.
I think
Dr.
it is.
Francois,
Oh, go ahead.
you think? Oh,
oh, I think it's both, but probably more so social media has played a huge role in
mhm,
a lot of the diets that have come about, and especially like TikTok. I mean, you could sit all day long, and there are different, they come up with different names for like the same type of diet. At the end of the day, all of the diets are like, you're restricting calories, basically. But we come up with different names and different ways to make us feel better
mhm.
about about it, or make it seem easier for us to do. But I really think it's been driven by, of course, both, but more so by social media.
You and I
I
spoke about
agree.
it first, Celebration, about the diet trends, especially on TikTok. I'm sorry, Dr.
Oh
Thompson.
yeah, that's right. Ozempic, yeah. Yeah.
Yeah, I was just going to agree with her. I think the social media is a huge part of it. Also, just technology, with how people can stay so much in tune with with marketing now.
Mhm.
You've got 24/7. When I was a child, that little dot in the screen and TV went off. You all would
I
y'all would
remember
y'all
that.
wouldn't know about that. But you didn't have 24 hours of TV. You didn't have cell phones that could keep you in line with stuff and see what the next thing is. So now you can be 24/7 engaged, and the
Mhm.
corporations take advantage of that with
Hmm.
commercials and everything like that. So and the other thing about the diets is that um, if you if you strip away one thing that tells you that plant-based is really the mainstream here, the underpinnings of good health, is that you can take almost any other diet, and if you isolate it, like let's say the keto diet, which isolates meat, right? And yeah, you can eat veggies and stuff, but if you say, okay, the main thing about keto is eating meat protein, and say only eat meat, you don't eat any veggies, nothing else, just meat, you'll die after a while, because your body just isn't designed to own. We are not by design carnivores. We don't have the tooth structure, jaw structure, eye structure, ear structure, body
Mhm.
structure. We're just not carnivores, and so we don't prey on other animals by design. On the other hand, if you take plant based, I'll just zoom straight to plant based, and you strip meat out,
Mhm.
and you can only eat plants. Well, we know you can survive. We know there are major studies that go past more than 20 years that say how healthy you are. We look at the blue zones. I mean, some of them occasionally eat meat. They're not vegans, but still, when you strip away everything else, plant-based is the only one you can really strip away everything and still be healthy. With and the other diametrical opposed that is meat. Strip away everything and just eat meat, and you're not going to last very long.
Mhm. So, what does the science say about intermittent fasting? Is it backed up by some research? Is it just kind of a well, we've seen what kind of works for some? What do you say, Dr. Thompson?
Yeah, there's some research that shows some advantage, but it's mixed. There's some
Mhm.
research that shows that it helps overall. But what does overall mean? I mean, really, you want to
Mhm.
be specific about things. We know people can lose weight. There's some research that shows that people have lost weight. There's other research that shows people didn't lose any significant weight. But
Yeah.
I think we always look at the preponderance of evidence in these situations. We know with intermittent fasting, there have been markers that have improved. That we know that insulin resistance
Mhm.
has improved.
Mhm.
We know that some brain function has improved. There's something called brain-derived neurotrophic factor that goes up with exercise, that goes up if you fast. Um, we know that with other types of fasting where you go even longer, stem cells get stimulated. And there's some evidence that even with some of the more restrictive subforms of intermittent fasting, where you restrict for more than 16 or 18 hours, you might stimulate those stem cells. Stem cells are these cells, these special cells that help to rejuvenate different tissues in your body. There's stem cells for the heart, there's stem cells for blood vessels. And as you get older, these stem cells tend to not be as healthy also, and that's part of aging. But they've shown in certain fasting situations and some studies with intermittent fasting, it can have an influence on that also. So there's some attributes to it. But again, I think you don't get anywhere if you don't pair it with healthy eating. I just
Mhm.
don't think you get the results if you don't also
Mhm.
pair it. And we were talking about time of eating. It's many studies have shown by really, they have this. There's this construct where you eat like a king or queen in the
Mhm.
morning, in terms of proportionally how much you eat, healthy food we're talking about,
Mhm.
and eat like a prince or a princess, for lunch, and eat like a pauper in the evening. And that's just been shown to be more physiologically
Mhm.
healthy. And so
Mhm.
most, it's the other way around in this country. But and I've had some problems with that myself. I just can't wrap my brain around eating my dinner in the mornings.
Mhm.
But conceptually, it's shown that makes a difference.
Mhm.
I see a
Yeah.
question about intermittent fasting. Someone's wanting, or Shelly Morris is wanting to know if intermittent fasting is good to help lower insulin resistance. Who wants to take that one?
It
I think
is. Yeah.
yeah, he just mentioned it. Right. Yeah.
Hmm. Okay.
We want to be
Um,
careful not to say. I almost think when you say intermittent fasting is almost like generically saying eat healthy, kind of, because it could be, if you're doing intermittent fasting where it's just 12 hours, or
mhm.
you aren't as restricted, you may not get those kinds of results. You may have to be a little more restrictive to see those results, along with changing your diet.
Right. A good point, Dr. Thompson. I was about to mention that, like, what are we doing if we fasting for 16 hours? What are we eating during those 8 hours that we allow ourselves to eat? If you're still continuing to consume high fat foods, um,
Mhm.
and you just the sugary drinks during that time, then it's like null and void, because you've packed in everything that you would have consumed for the entire day into those 8 hours. So then now it's not going to be a bit any benefit to you whatsoever.
Yes.
So then I'm one of those ones that's like, okay, I know I need to stop eating by say 7 o'clock. You're watching TV 9 o'clock, and you're like, looking at the kitchen, like,
I know that feeling.
what do you
Yeah.
do then?
I know that feeling. Yeah. Well, sometimes it breaks down. It's not a perfect world, but what makes a difference is what you choose to break down to eat. If you choose to break down to eat a Snickers bar, you're in trouble. If you
Yeah,
choose to eat a
right.
banana or some pistachios, not the salted kind, um, you're on better ground.
Mhm.
So, I mean, if
Okay.
you can at least not eat within 2 hours of going to bed, that's still going to make a difference.
Mhm.
So I tell people don't get anxiety over this, don't, because
Right.
that's not going to help. So if you need that snack, and you can do that, up to 2 hours before bedtime, then go ahead and get that healthy snack. The reason why you don't want that sugary snack is because that causes an insulin spike. And when it spikes up, what happens? What goes up must come down. And when is it coming down? In the middle of the night. You get up to use the washroom and you feel like you got to eat again. you know?
I
so,
know that feeling.
so, or you're just uncomfortable because you shouldn't and you can't get
Mhm.
back to sleep. So yeah, it's one of those things.
Okay. And we mentioned the, let's see, Devania, and I'm sorry if I'm pronouncing your name wrong. Davis says, what about the push for those high protein diets while losing weight and gaining muscle? Dr. Francois, what do you say?
A high protein diet would be does help with muscle for formation. It's just of course the type of proteins that you are going to consume that we want to be careful about, such as I'm not saying, go out, oh, let's go eat pork chops and, ribeye or something like that. But more so, if you had like chicken breasts or like he mentioned, the pistachio nuts, walnuts, pumpkin seeds that are also high in protein, a lot of beans, black beans, like our legumes, lentils. I think it's a very good idea when you're, trying to gain muscle
Mhm.
and you're exercising. Um, I think it's a good idea to eat high protein.
So I think that also answers, Terrence Taylor was asking about options about building muscle while working out and what to do if you're going away from animal proteins. Dr. Thompson, it seems like this is for you too.
Yeah. Well, that's the one situation. If you're trying to build muscle and you're doing those, exercise for building muscle, then you certainly may need more protein. And so,
Mhm.
one thing to do is make sure you're eating more foods that have higher amounts of protein. So that's again the beans. Go to town on the beans and on the soy. Don't be afraid of soy. That's a myth that you should be afraid of soy, whether you're male or female. Um, and those whole grains, the more unprocessed those grains, the more intact they are, the more protein you're going to get out of those grains. And if you get the feeling that's still not enough, or your trainer thinks you need more sources, there still are plant sources. Chlorella. I used to say spirulina, but there's some issues with spirulina. But there's some other types, other ways you can get in, as Dr. Francois said. Nuts and seeds have a lot of protein.
Mhm.
So I think there are ways of doing it in a healthy way without using a lot of animal protein, which I mentioned already, has
Mhm.
its risk with elevating certain not so good hormones. Even though you might build a muscle, at what risk?
Mhm. That makes sense. So I'm going to kind of combine these next two questions for time. But Dr. Francois, can intermittent fasting or any of the other diets improve your metabolism, or does it slow it down? And how do they impact hormone levels, blood sugar, and energy levels?
So when I was like looking up like the research, and you can help me out too, Dr. Thompson too. It was saying like intermittent fasting can like give you a boost in your metabolism, but at the same time, like with weight loss, sometimes when we have a significant amount of weight loss, that can lower our metabolism. So if you're doing intermittent fasting and we lose weight, we lose a significant amount of weight with that, then that could kind of lower our metabolism. But the main way we want to like increase our metabolism um, consistently, increase metabolism is through exercise. And so that's the main thing you want to do when you're trying to increase the metabolism. And as far as you mentioned, what was the next part of the question about diet?
Um, the hormone levels, blood sugar, and energy levels.
Blood sugar. I think Dr. Thompson, you touched on that too
Mhm.
about like intermittent fasting being of benefit when we're trying to control our blood sugar levels.
Mhm. So what about
Yes,
when
and
you're on the GLP-1, if I'm pronouncing them right, if you're on those and it feels like you can't really eat a lot anyways, are you technically kind of fasting? Sort of, not really, but do you see where I'm going with it? Or am I reaching?
well,
No, go ahead, Dr. Thompson.
well, you're definitely not fasting unless you are
Yeah.
fasting.
Okay.
but
Yes.
but yeah, I know what you mean because they make you feel full faster.
Right.
So that branches down the appetite, and your stomach doesn't empty as fast.
Hmm.
So for those who and insulin levels improve. So a number of good things do happen with those GLP-1 agonist, which means they actually stimulate the receptors. The problem is we just don't know what the long term effects are. That a lot of people think, well, maybe I should feel comfortable because these medicines have been around for treatment of diabetes for 20 years or so, and yeah, to some extent they've been around, but the problem is not at the doses they're being used. So, and sometimes we don't find out for 10 or 15 or 20 years what the consequences are when you double a dose or get higher on doses for long-term periods in a different setting, like in a person that doesn't have diabetes.
Hmm.
So those are unanswered questions. And we know the short-term side effects are people feel kind of nauseous and they have other kind of
Mhm.
stomach side effects. And there have been some people who have had some problems with their bowels moving once they've been kind of slowed down like that, where and like almost like paralysis. There've been a number of people that reported that they've had some problems, and sometimes these problems don't go away after stopping the medicine. The other fact is the other problem is a rebound effect that can occur. If you do stop it, say your insurance runs out or your money runs out, or you just you just feel like you can't take some of the side effects anymore, and then all of a sudden you boomerang back to where you were. So I
Hmm.
caution people, but I think you should take the dietary approach first. And I think it does help. If someone is obese, I mean, it makes a difference losing 10, 15% of body weight, healthy wise. You don't have to look like like Twiggy would be, not the generation, but, but you don't have to be real. You don't have to be real thin. You just losing, if you lose some of your body weight, then you're gonna start being less insulin resistant, and you're gonna have
Hmm.
less risk for some of the obesity related diseases. But
Hmm.
I'm not a fan of it as a first choice. And then if people do plan to use it, they should have an exit plan, because when you sign on to that, it's for the long run. It's not like, okay, in 6 months we stop, or in 1 year we start. Even though you may not have diabetes, that's not how it works. You're on it for a long time, unless you have an exit plan where you're going to make some wholesale changes in your diet and lifestyle.
Okay. Okay.
That is 100% correct. Yes, the have to have an exit plan. Also, we typically don't like recommend like intermittent fasting while someone's taking the GLP-1
Hmm.
medication due to like the nausea. Typically, when you go long periods without eating, that nausea really kicks in, and vomiting quite a bit. So we recommend very small meals, snacks throughout the day when you're taking the GLP-1 medication. And we wholeheartedly believe too that you must. It's almost like a requirement for me. You have to make lifestyle changes while you're taking these medications. Um, you have those that they continue to eat the same way and take the medication and they're losing weight, yes, because they're not consuming as much, but they when it comes time for them to get off of the medication, the weight comes back tenfold. uh,
Hmm.
and so while you're taking, we use the medication as a tool. And so while you're making these lifestyle changes and trying to make healthier choices, the medication, I feel like it helps with suppressing appetite. So you're not hangry all the time, hungry and angry.
Hmm.
I get. But the medication helps with that. So while you're making these lifestyle changes, and now you've gotten to the designated goal weight that you've come up with your provider, then what we do, we go into like a maintenance plan where we're weaning you off of the medication and ensuring that, hey, are you making sure you're getting your protein, are you still exercising, Are you still eating your fiber at the same time? So, and I feel like it makes it a lot easier and more gradual approach when you do the maintenance and kind of wean off of the medication, and then now you're the lifestyle changes have totally kicked in, and you're able to maintain and sustain um, what you have accomplished. Yeah.
Okay. So you just mentioned something that I wanted to touch on really quick, exercise. When you are intermittent fasting, what is that window where you should exercise? Because if you're still in that fasting window, should you exercise then? Because I know me, I need some energy like to get through a workout. But so I may do a banana, some kind of carb or something like a banana or whatever, but or protein shake. But what is the suggestion there? Should they people exercise within the window where they're eating?
Well, I think people generally would do what they're comfortable with doing because some people exercise better, with food on their stomach. Not
Hmm.
me. I try to be as far away from a meal as I can. So it worked out when I do intermittent fasting on the days I do it. I have a good workout in the mornings, and
Hmm.
I'm used to doing it on an empty stomach because that's where I prefer. I don't think it's probably good to have a heavy meal and then go right
Hmm.
to exercising. That's probably
Mhm.
not
Yeah.
good. But I think people should do what they feel comfortable with and realize that if they decide to have that banana or power drink and it's during the fasting window, you're disrupting. You're not doing
Hmm.
intermittent fasting anymore.
Right.
It's even if it's some tea and lemon, because the lemon, I mean, it's going to activate your microbiome. So you want to be careful with that. There's certain things that are allowed usually with intermittent fasting. Water's the best. Some
Hmm.
people, sometimes tea without any lemon or sugar is allowed, but I think to not disrupt what you're trying to achieve, you probably want to be close to just water as possible.
I was gonna ask, can you put a little just something in that tea, or do you have to do black coffee? Can it just a drop of something to go in there with it? I guess not.
Some do allow that, but there's some nutrition. Like there's a Dr. Will Bolsowitz he's written some wonderful books. Um, he's on YouTube on the exam room a lot, and he's a wonderful educator, great credentials. He's a gastroenterologist, is plant based, and he warns that when you do these things that can be digested, then they can disrupt what you're trying to do in the fasting state. So it's best to just do water.
Okay. Okay. Dr. Francois, are there specific groups of people who should just avoid intermittent fasting? It sounds like you talked a little bit about those that are on the GLP-1, but what about pregnant women, diabetics, athletes?
Most definitely, yes. Pregnant women, those that are breastfeeding, those that have a history of eating disorders, um, should probably, kind of avoid intermittent fasting. They have an issue with binging, or anorexia, something like that. They may want to stay away from intermittent fasting. Um, Athletes, I've seen they do it quite often,
Mhm.
the intermittent fasting. So I don't think that would be a problem either. Like Dr. Thompson mentioned, you have to do what's most comfortable for you. Some do well with eating and exercising, and some don't. I feel the same way. I can't exercise on a full stomach. May likely come up. So no, we might want to avoid that. But that's generally the population that we would probably have to kind of stay away from the intermittent fasting. Anything,
Okay.
anyone else, Dr. Thompson, that we missed? Did I miss?
I think you pretty much hit on it. People have to be careful. Diabetics do have to be careful. I think did you mention diabetics? Um,
Yes, Shamika mentioned. Yep.
yeah,
Mhm.
I- and then people just on certain medications. You have to be
Right.
careful. Talk with your doctor. Just let your doctor know what you're doing, just in case medications you're on may make a difference with that.
Right, especially if those that
Yeah.
there are some medications that require you eat. You take the medication with food.
Mhm.
So
Yeah.
Oh, it's a good point. It's a good point. I guess I'll get some of these questions in the comments. I see Carlene, and I'm sorry I can't pronounce her last name, but um, they're asking, is mushroom coffee good for you? Can that help you with weight loss? I That's an interesting question.
That's a good question, and Thompson, because that's very popular right now, and I don't know.
I don't know either, but I'll say that mushrooms tend to be very healthy. They have a lot of attributes in terms of anti-cancer. They have a little
Mhm.
vitamin D in them. Um, they're just a very healthy thing to have. And if you have it in the form of your coffee, I can't see why there'd be a problem. I don't know of any studies though
Yeah.
that address that. So I don't know.
I'm curious as to what it tastes like. Does it taste like mushrooms or does it taste like coffee? I guess I'm just going to have to try it.
I tell you,
uh,
I'd rather people have that than the bulletproof coffee.
Right.
oh, yeah, yeah.
Which is like
Right. The
butter in your
sugar
coffee.
in the coffee, yeah.
Oh yeah.
But yeah, it's not the don't you Shamika don't think it's like Starbucks or something like that. Um the mushroom coffee, you know.
Mhm.
And if you're putting sugar in it, it's 3 steps backwards. So
Right. You might as well go ahead and get your Dunkin' Donuts.
sugar and milk. Oh boy.
Dr. Thompson is like, don't even just don't even bother. Devania Davis wants to know. So while trying to body recomposition, should carb intake be higher than proteins? Because they're trying to understand macros. What should be, and I know I've heard protein should be high, but where do the carbs fall? Especially, if you're also trying to get stuff in that window when you're intermittent fasting. Who wants that question?
Well, I don't when you're eating plant-based, first of all, you don't have to worry about macros. So that's why I don't delve into it too much.
Okay.
If people are doing the macro diet, then of course they do have to, you know,
Mhm.
watch what they're eating in terms of what the proportions are. But that's why I don't like the macrobiotic diet. I like plant-based because you don't have to worry about that. It's going to figure itself out if you're eating these healthy foods that have their own proportions. We
Mhm.
don't want to have high protein. I think you're going to get enough protein with a balanced meal that you don't have to push the protein. I think, with exception, like we said, with your bodybuilding, then you may need more. But we don't need nearly as much protein as we think with most of the diets with most of the food we're consuming. And then as far as what was the other part of that? The calories, or what was another? There was a second part to that.
Let's see if the carb
Oh, the
intake should be
carbs. The
higher.
carbs.
Mhm.
So yeah, and that's again, the problem with saying carbs is, are we talking about processed carbs, or are we talking about complex carbs, like in a sweet potato, or even a white potato, in a whole food, or in any fruit you might pick? Because those are different carbs than carbs that are processed, that come in a box, bag, bottle, or can. And those usually are the carbs that can cause insulin spikes and drive inflammation and cause you to have pre-diabetes. But if we're talking about whole food, that's a whole different ball game. And those carbs usually are healthy carbs if you're not already pre-diabetic. Now, you have to even be careful with some natural carbs like bananas and grapes and things like that if you're already pre-diabetic.
Mhm.
But if not, you're going to be healthier eating those foods, and you don't have to measure the amount of carbs. Your body will handle it. Your fiber will get you full sooner than you overdo it.
Okay. Well, would you say that, and Dr. Francois, this is for you, is intermittent fasting a lifestyle or just a temporary weight loss solution?
That's a good question.
Mhm.
um, I would say it could definitely, I guess it could be both. If someone is able to, like I said, sustain that type of diet or doing intermittent fasting, if they're able to sustain it, that's great, and like you like, and we're talking about the patient population that we recommend would do it, not the ones that should avoid it. But um it could be both. And yes, typically you would see weight loss if you are, during those hours that you are eating, eating properly and making healthier choices. And sometimes I think that's where there's like a slippery slope with intermittent fasting, because how it's described by some of my patients is, I can eat whatever I want during those 8 hours,
Mhm.
and then because I'm not going to eat anything else. But and then you typically won't see the weight loss that you might be looking for if you're going about it in that direction. But if you're eating like the whole foods, healthy, making healthy choices, and doing intermittent fasting, yes, you will see weight loss. And it's whatever works. It's a personal choice, like whatever works for you. Intermittent, I'm with you, Shamika. Intermittent fasting didn't work for me. Dr. Thompson, he was able. You said 2 weeks. How long did you do it? No, you did it for quite a while, right, Dr.
Yeah, I
Thompson?
No,
did it for 2 weeks.
Oh,
yeah,
2 weeks. Okay,
yeah, I did it for quite a long
quite
time.
a while. See, yeah, and I'm more of like 2 days. So it just was not sustainable for me.
Yeah.
Yeah. So that's actually leading me to my next question, Dr. Thomas. How long is this sustainable for those that have that willpower and can do it? Like how long is it okay to do intermittent fasting? Because I know we talked about keto, you shouldn't do it at all, but here we're talking about intermittent fasting and maybe perhaps including those whole foods. How long can you do it?
There's no expiration date on that. I mean, it's
Okay.
unlike keto. I'm worried that a person will expire if they do it too long. There's
Mhm.
no expiration date for if you're doing intermittent fasting safely. If you're doing it in a way that you are when you break the fast eating healthy, you can do it all your life. There are people we know that have that's a cultural thing that they fast.
Mhm.
So we know that's sustainable for some people if they
Mhm.
choose. But
Mhm.
also, unlike jumping off of GLP-1 agonists, if you deviate and go and stop doing it, you're not going to have rebound problems generally from it, unless at the same time you're going all out back into standard American diet and all that. Then okay, you're going to be doing poorly. But it's the risk of it really aren't. There's not much other than the situations we described where you should probably talk to your doctor first or consider not doing it. You can do it as long as you want. Now, I will say that this doesn't directly align with intermittent fasting, but if you are going plant based, you need to make sure you're taking B12, vitamin B12. It's very important. Plants don't make it, and animals don't make it. It's something
Mhm.
made by bacteria, but generally, when you're eating just plants, you're getting less of it. And so you want to make sure you're getting adequate B12, and that depends on your age, in terms of what your needs are, as well as your diet. And so I strongly advocate that, and vitamin D if you're not in the sun enough to make that hormone,
Mhm.
and having your regular follow-up visits with your doctor.
Okay. This conversation again has been so good. So we're at the last question. What's the key takeaway that you want people watching to leave with? Because there you have dropped a lot of gems through this entire show. There's so much, but what's that one thing you want? If nothing else, if they don't retain anything else, what do you want them to remember? Dr. Francois, I'll start with you.
And I think I'll stick to what I mentioned last time. Take one day at a time, one step at a time,
Mhm.
and making healthier choices. Um, that is always my approach that I try to, give to others. That take it one day at a time, and don't try to do too much all at one time. There are going to be a lot of different diets that come our way through TikTok and the social media, and stick to something that works for you. There's no like cookie cutter um, diet that will work for everyone. So stick with what works for you. Take it one day at a time. Don't try to jump on every trend that's out there. But especially always talk to your healthcare provider first before starting any type of diet or any type of making any type of changes to your dietary consumption. So that's always my main thing. take a slow approach. It's okay. We live in a very rapid paced world, but just take it easy, take it slow.
That's great advice. What about you, Dr. Thompson? What do you want folks to remember?
Well, I'd like them to remember that I gave this shameless plug of a book that I just published a week ago.
Yes, keep plugging. I was wondering when you were going to mention it. Oh, we get to see it.
Oh, I don't know if it'll focus, but
Oh,
I have to tell you the title. It's
oh,
called Fearless Wellness.
There it is.
Yeah, Fearless Wellness, transforming your life one step at a time. And it's a holistic book. The Fearless is for acronym: food, plant-based, exercise, avoiding toxin, restorative sleep, lessening stress, engaging your mind. If you have a 60-plus-year-old mind like mine, you need to keep it engaged. And then the last two S's are for social energy and spiritual connectivity. And then I have several bonus chapters to talk about COVID and Alzheimer's and probiotics and cravings and a lot more. So it just got launched on Amazon. I was too far into that retailer, with all the other stuff going on. I know some people trying to avoid Amazon, but I was too far in. But it's on Amazon, and it's actually made the bestseller list over the last few days in terms of new releases, and in the nutrition category and in the vegan category. But it's not a vegan book. I try to meet people where they are, and this jives with my last statement that really I want people to leave knowing that whatever way they move the needle, as long as it's in the right direction, which should be eating more plant-based foods, less processed foods, and not forgetting these other core elements of life: relationships, movement, spiritual connectivity, and purpose. If you have those things in balance, you're going to do just fine. So that's how I would end. Thank you.
Congratulations. First of all, congratulations on
Thank
that.
you.
That's amazing.
Appreciate it.
Yeah, and you said people can pick it up on Amazon?
It's on Amazon. If you put in the title, you'll get right to it. Fearless Wellness. There's no other book that has that title, I believe. And then I have a website that's called fearlessmd21.com, where a first page has a link to it to buying the book on Amazon. fearlessmd21.com. So thank you.
Perfect. And Erica, where can people find you? You have a website?
Yes, www.newvitalitylife.com. And although I talk about social media a lot, I am on there quite a bit too. Dr. Mrs. Francois, and on Instagram and on Facebook as well.
Perfect. Thank you both for coming back for part 2. Both, and if you guys missed it, definitely go check out part 1. It was just as amazing as this conversation. I know that I've learned a lot, and I won't be trying intermittent fasting right now, but I have learned a lot. So thank you. For more information on nutrition and food as medicine, intermittent fasting, and everything we talked about, there's plenty of articles over at blackdoctor.org. So again, thank you. And thank you to those in the chat that were asking some great questions. And I hope everyone has an amazing night. Good night.
Good night.